2023. And we started with Dr. Alfonso Martinez Nova. He's gonna tell us their experience for 25 years ago using a phenol-alcohol technique. Let's start.
Thank you very much. First of all, I want to apologize because I am going to geek the Shakespeare language as well. Voy a dar un puntapié a lengua de Camões. For us, it's difficult to speak in language, but we are going to try. The slides are in English and in Portuguese too, in order to understand better. I have seen a lot of conference this morning, but no blood. We are podiatrists, we need blood in ulcers, holes, to treat and to try to improve. We know that an ingrown nail, it was first described in 1845, like a nail growing inside in the flesh. But we know that in the most of cases, the problem is in the lateral fold. There is not an alteration in the nail, but we have a lateral fold that is growing, that is being inflamed, being swelling, and is the real problem, no an alteration in the nail. You can see this is one of my favorite patients because she has plantar warts, Pyogen granuloma, and ingrown toenail. En portugués também, para poder comprender. Not bad. Well, what is the location? We have mainly the ingrown toenail that we know is in the hallux, in the first finger, but in this case of 10 years old patient, it could be also in the second or in the third lesser toe. This is more easy for us to manage than the first toe, and for the patient too, because he can cut, or father's parents can cut the nails, are thinner, are thinner and more easy to manage. We have found that ingrown toenail is more common in men than in women. And we have a proportion of 2 fibular folds than tibial folds. And the fold that is next to the second toe. Well, what we know about conservative treatment and nail rehabilitation, we have a wide range of treatments in podiatry. Speaking with a Brussels colleague, I said that we have a wide range of treatments. We start with nail retraining, nail remodeling, orthonixia, but sometimes we see that it's not enough. When is not enough? When we are in stage 2B or more, the nail retraining, the nail rehabilitation, the orthonixia is not enough, is not working as well. Our patients say that a 6-month treatment is not good for them, and we need surgical treatment in stage 2B or more. For us, as we have this kind of treatment is more easier to perform surgery than perform rehabilitation with a lot of months of rehabilitation and no good results. Okay, what says the evidence? In this study of Cochrane revision, says that surgical approach are recommended for moderate to severe ingrown toenail because the results are much better than rehabilitation. And this is an evidence rate of a B, which is a relative strong recommendation. The cat is muy bueno.
Reading military strategy.
Yes, of course.
Yeah.
Military strategy. Okay. What are the main objectives of nail surgery? The ideal surgical procedure must achieve a high degree of patient satisfaction, is the most important thing for us, functional and aesthetic, and a quick incorporation to normal life. Normally, we explain to our patients that in the same day they are going to their home, walking normally with a little bit bandage, but they can be in a normal life in 2 days. 2 days of a little bit of rest. And we have to achieve a good longitudinal growing of the nail, the rehabilitation of the lateral fold. We have to cut the lateral fold or trying to cut the last nail that is possible. Em português? O procedimento quirúrgico ideal? No. Well, the most known technique in ingrown toenail surgery is phenol-alcohol. Why? Because this technique arrives from the USA. It's very easy to perform. It's very safety. Have a low recurrence rate, a very, very recurrence rate, maybe 1 or 2% of recurrence rate in this kind of technique. It can be performed even in diabetic people. It can be performed if with infection. It's not the ideal thing, but you can perform in this way. O que facemos é arremosado do espícule, unha quemadura con fenol. The phenol is an acid that when we remove the nail, we have the nail matrix, we put the phenol in this way, and we make a burning, a 2-degree, second-degree burning in the nail matrix. Then, if there is not nail matrix, it will be not nail after. First of all, with a not cutting instrument, we separate the nail from the lateral fold. The position of my hands is not the real, because I want the camera to take well. If we are doing a good separation of the nail, the extraction will be better. After, with a phenol, alicate, we cut a little bit portion of the nail, and with the scalpel, we continue this cut beside the eponychium. Without cutting the eponychium. It's very important not to cut the eponychium. You can see that I cut a little bit of nail. Then with a hemostat, we extract the nail. And you can see that there is a little bit cut, but you can see the form of. We remove the hyperkeratotic tissue that is around the nail, because if not, the phenol will burn this kind of tissue, not the nail matrix. So with a Martinez cucharilla, sorry, we remove the curettage, a curette. Okay. We remove, first of all, the hyperkeratotic tissue.
Minutos.
¿Eh? ¿Qué llevo?
5 minutos.
¿Qué me faltan?
Te faltan.
Vale, okay, no problem. Okay, in this way, we apply the phenol, then alcohol, phenol and alcohol. 2 burnings of 30 seconds. It is in the literature that this kind of burning will destroy completely the nail matrix. We don't need more. However, this kind of technique have a big disadvantage. This big disadvantage is delayed healing, prolonged serous drainage, and increased risk of infection. We see that we need near a month or 20x days to recover this kind of surgery. And for me, this is a big problem because there are more risk of infection. In these 25 years, applying the phenol technique, other colleagues say me, I make the cures with iodine povidone, with enzymatic cream, with a lot of things. But the time of the recovery is the same in all. A lot of cures like honey, yeah, honey. Well, the honey has found in the Tutankhamun tomb, and you can eat this honey. There is too much sugar and microbes that don't grow. Paraffin gauze, povidone iodine, drenagem de nanoplata, a lot of things, but what are the evidence of these things? With controlled fluke electrolyzed acid solution, that is a water very, very acid, that don't allow the microbes to grow. Well, a new point of view is that there are many products currently that have hyaluronic acid. This is the sense of the hyaluronic acid is to provide a good environment to the wound to allow a better recovery. Okay, there is a lot of people in Facebook saying that hyaluronic acid is the best thing in the world, and in 2 days you have the recovery. And our question was, well, it will is efficacious? It has effect or not? Well, this was designed as a clinical trial with colleagues of University of Malaga, Raquel and Raquel Alabao, and other people. And we get a sample of 70 patients, 20 women and 50 men. You can see the proportion that I said previously in my experience, with a mean age of 22 years. The inclusion criteria were patients who require and request surgical treatment, patients that arrives to our clinics to a surgery, between 14 and 40 years old, client classification in stage 1, 2, or 3, or Mocena stage 1 or 2 or 2B, and no prior systemic pathology like important diabetes, coagulation, or immunological disorders. This was registered in the clinical trials registry of clinical trials. Okay, in this case, we have two groups. The experimental group, it was formed by 35 patients. We performed the same technique in the two groups, but in one group, the first cure in the 40 hours after the surgery was with 1 milliliter of cream of hyaluronic acid, and in the other group, in the control group, 1 milliliter of povidone iodine, of betadine gel. The non-stick dressing was the same in the two groups. So we have the same kind of surgery, the same time of application of phenol, and the only difference was the first cures, and we performed these cures in the days 4, 6, and 8. After the 8th day, we cured both groups with the povidone iodine to dry the wound. Okay, what was the main results? The recovery days in the control group was about 3-4 days less than in the control group, 23 days against 26. We have 3 days of improving in the hyaluronic acid group. Another result was the pain score, the pain suffered by the patient seems to be a little bit less in the hyaluronic acid group. In the control group. This result is a little bit strange. Seems to be a little bit less, but not in the first visit. What says the literature? We have studies of Dobison with povidone, iodine, hydrogel, paraffin gauze that says that phenol technique recovers in 33 days. And another study says that with a controlled flux electrolyzed acid solution, with 26 days, with a nano-silver drainage, 24 days. You can see that in our group with hyaluronic acid, 23 days, 24, 26. You can see that 20x days will be needed to cure. The results are not explosive. They are not a very, very interesting results because we have not reduced a lot of days. The discussion, hyaluronic acid cures improve the post-surgery healing period by around 3 days compared with the povidone iodine gel. And we can save, we can save 1 post-operative visit. So in our patients curing with hyaluronic acid, you can save only 1 post-operative visit, only 3 days. What are the key points? Hyaluronic acid could be useful for the recovery of the phenol technique, but the cost of the cures is very high. Hyaluronic acid cream is expensive. You have to take to the patient to buy this kind of cream. So there is too much expensive, buy the real recovery improvement that we have found. We still have a second-degree superficial burning that needs 20x days, 22, 23, 24 days. You will need these 20x days with every cure that you apply in the total recovery, independent of the cures protocol. I say a joke that if I have a phenol technique and don't put any cream, maybe 25 days. Okay, with no cream, with no cost, with everyone. Pontos-chave, ¿es correcto en portugués? Pontos-chave. Está bien. Okay, this is the same slide. Thanks you for your attention. You have here my social media if you want to follow me. Thank you.
Thank you. Thank you.